And let me know if you can share, if you can see my screen, all right? My bad. What do you see? Holistic strategies for preventing cancer? Is that what you see?
Yes, ma'am, that's what we see.
Alrighty, cool. Yeah, so today we know we are all here to talk about holistic strategies for cancer prevention. And so thank you so much for leaving your families, for leaving whatever you had to do this afternoon to be here with us, right? I'm here to share some insights on how we can take proactive steps towards reducing our risk of developing cancer. While there's not a one-size-fits-all solution to preventing cancer, adopting a healthy lifestyle and incorporating natural remedies can significantly reduce your risk of cancer, and that's what we're going to talk about. So you may be wondering, like, yeah, she has a master's in public health, she has a bachelor's in nursing, and she's also a pharmacist, right? Like some people call us like drug pushers. But let me tell you how I started my own holistic journey. One day I woke up in severe pain and I could not walk. Every time I tried to walk, I was like, gosh, so much pain. I was in so much pain. I had to like drag myself around the room in a chair that had a wheel, like going everywhere. I took some ibuprofen. I'm a pharmacist. Yeah, I know the drugs to take. I know the doses to take. I took some ibuprofen. It did not help. And I was like, okay, let's take some Tylenol as well. Acetaminophen. I did that as well. And it did not go away. And I'm like, what's going on? I then remembered that one cardiologist had talked to me about curcumin, which is the active ingredient in turmeric. And I was like, okay, maybe I should try that. Maybe that will help. Yeah. So I dragged myself to the store because, you know, when you're in pain, you can do anything for that pain to go away. So I dragged myself to the store and asked for the best curcumin that they had. You won't believe it. I just took one tablet. Yeah. One tablet and the pain disappeared. I'm like, okay, what was that? So I realized I was having inflammation despite me thinking I had a healthy diet, all of that stuff. After that day, I became a firm believer in the power of quality natural supplements at the right doses. And this is how I started my own holistic journey. I think I don't want to mess up here, right? So let me know if you can see my screen and what you see. So we're here today because of Deba. And Deba is on a mission to close the healthcare gap for African women everywhere by reaching them with quality healthcare through their spaces, their technology, and by their products. All righty. Bottom line, cancer, we all hear it everywhere. Cancer is a group of diseases characterized by the uncontrolled growth of cells, right? Uncontrolled growth. It's not like you've got control about it. Growth of abnormal cells, right? So let's begin by understanding the causes and the common risk factors of cancer. The causes for cancer are like multifactorial. It's not just one thing, right? It could be like your biology. And what is that? Yeah. Your age, your genes, the genes you get from mama and papa, everything. Yeah. Your hormones, they can increase your risk. Risk of cancer increases with age. Changes to some genes that you got from your parents when you were born can increase your risk. Taking hormones such as estrogen, progesterone, so hormones in birth control pills can increase the risk for cancer. But in reality, so don't say I'm going to stop taking my birth control pills, all right? Keep this in mind. In reality, the only population that should be concerned about taking the pill are women who are at very high risk, such as those with the BRCA mutation. And if you're like wondering what that is, the only way to know if you have it is to get tested, and Debo can help you with that. So it's important to note that not all cancers are preventable, but many lifestyle factors can influence your risk, right? Things that you're exposed to in the environments. So you wonder when like people like wonder, all this environment stuff, like what's the big deal? It is a big deal because you are inhaling it, you're drinking it, you're eating it. So things like you're exposed to in the environment, such as cigarette smoke, chemicals in polluted water, pesticides that are sprayed on your foods in the farm when they were growing, and you eat it, can increase your risk. Yeah. And even excess radiation from the sun, and even say if you go tanning, who knows, can increase your risk. Lastly, also a poor diet, smoking, excess alcohol intake, and some viral infections can increase your risk of cancer. Let's see, I see something in the chat. And guys, let me know, just come off if you can hear me, please. So what can we do about it, right? Fortunately, there are some proactive steps we can take to reduce our risk of cancer. So adopting a healthy lifestyle can have a profound impact on preventing various types of cancer. So what can you do? Try to eat a balanced diet. To prevent cancer, limit your intake of processed foods. And it's so easy because we are all so busy, but do the best you can, all right? Foods like sausages, who knows what they put in there, right? Limit your intake of refined sugars, red meats. We like a lot of red meat in Nigeria, so be very, very careful. Don't eat too much. And foods that have pesticides on them, like I said earlier. Try to eat more plant-based foods because they are rich in fiber, vitamins, and minerals that your body craves. Avoid tobacco if you smoke, and avoid drinking a lot of alcohol if you drink. Regular physical activity reduces the risk of colon cancer, breast cancer, and endometrial cancer. Regular physical activity also strengthens your immune system. Research shows that exercise reduces cancer risk by 20%. Please, that 20%, I will take it. All right, it's a big 20 out of 100. If you can reduce your cancer with that, please. I don't like to say exercise. I just like to say movement. You know, a lot of us like to sit down and say, oh, you go get this one. You go get up, please. Go move your body. All right. This one is big and really dear and near to my heart. Stress management. Stress can lower your immunity and increase your risk of cancer. We live in a very high stress environment. And it seems that women, we carry on a lot of stress from taking care of the kids, the husband, the family members, and also working full time. We think we are superwomen, but please, your body needs to be taken care of. When we compare the number of new cases of cancer in Nigeria in 2020, 2022, my bad. 2022, women were 1.5 times more likely to be diagnosed with cancer compared to men. Listen, 1.5 times more likely to be diagnosed with cancer compared to men. And the most common causes of cancer were like breast cancer, and after that was cervical cancer. This is one of the reasons why I have dedicated my life to reducing the burden of stress-related diseases. So earlier in passing, I kind of talked about viruses causing cancer. You might be like, what do you mean? What is a virus? Virus is like one of those things you can't see. It's a small organism in your body that can wreak havoc, that can cause a lot of stuff. So viruses can cause the cold, they can cause the flu, and in some cases, they can cause cancer. What stress does to your body is that it lowers your immunity, and viruses can take advantage of that. The sad thing is that when you're used to stress all the time, you may not even know that you're stressed, but your body will start to tell you, and you just need to listen. So the way to prevent cancer is early detection, because you may not know. And I know that a lot of you, let's be real here, okay? I know that a lot of you don't like to get checked down there, or you don't like to go get a mammogram. But I want to tell you that it can save your life, okay? So if they say, go and get a mammogram, they say, I'll do it later. Please do it. It can save your life. Also, practices such as deep breathing, meditation, yoga, Just listening to things that calm you down can reduce your stress. So try to embrace that in your daily life. Another one that I used to take for granted was sleep. I used to think that that I would sleep when I die because I have 5 kids. I work full time. I have this business. I have this nonprofit. I like to do a lot of extracurricular activities. I'm like, sure, who has time for sleep? I'll sleep when I die, Jared. But please, my body started to show me. I started to tell me stories that I'm like, okay, Adiola, you need to start listening. Started showing me Pepe, like how you say, yeah. And I had to listen. Now I don't take my sleep for granted. I even mute my phone at night so that the phone does not affect my sleep. So adequate sleep helps regulate hormones and repair cell damage. Quality sleep also supports overall health and immunity. When it comes to environmental changes, I talked about a little bit earlier, do your best to reduce exposure to toxins that can lead to cancer. So how can you do this? Choose organic foods, organic chicken, organic fruits, vegetables, grow them in your backyard. Avoid tobacco. If you smoke, if you chew, avoid that, and use natural cleaning products. Another big one that I really want to talk to you ladies about is those chemicals in the makeup, right? Or actually, it's not the makeup. Yeah, chemicals in makeup, because those are hormone disruptors. They mess up your hormones and can cause problems. But also chemicals in those toning creams. Those toning creams, a lot of people trying to look fair and stuff. It's all good, each person to their own, but be very careful with the chemicals in there because they can disrupt your hormones in your body and lead to cancer. Please, please, please be careful. So we talked about healthy lifestyle, right? Where are we going next? We're going to talk about foods that can prevent cancer. A well-balanced diet is crucial in cancer prevention. So fiber-rich foods such as beans, groundnuts, peas, fruits, and vegetables help your body eliminate toxins. And bitter leaf can help inhibit the growth of cancer. Cabbage, broccoli, ugu, okra, they contain potent compounds that protect your cells against toxins. I want to also talk about the vegetables that we eat. In Nigeria, when we make vegetables, we like to cook it a lot, yeah? And when you're cooking, yeah, when you first put it in the hot water for the thing to come out, I don't even know what it is that is coming out, but something to come out, and then you then cook it again. You've done a lot of damage to all that vegetable, all the good stuff you were trying to get from it. All those antioxidants, most of them are gone, yeah? So you don't want to cook those vegetables too much. I know you're kind of used to your palate, but if you make a change, just so you're healthy and you take care of your body, you will start to appreciate the different tastes, right? I don't even wash any vegetable. I don't soak anything. I just eat it. Sometimes I just eat it raw or just put it last minute so that I don't cook it too much, so that I can still get the antioxidants and all the stuff I'm supposed to get from it. So that's your vegetables. Colorful fruits. Fruits such as blueberries, raspberries, strawberries, they're very rich in antioxidants that can help protect your body against cancer. Also, enzymes and chemicals in pawpaw may have anti-cancer effect. So if the men in your life ask you, what did you learn from this webinar? Tell them that guava can help protect against cancer. So just be very careful of all those seeds though. Everything in moderation, of course. Also, ube can protect against cancer. And then soursop has been shown to have anti-cancer properties. When you're cooking, please, I talked about the minimizing the overcooking. You want to eat a range of fruits and vegetables to ensure a broad spectrum of antioxidant intake. Healthy fats from sources such as olives, avocados, fish, flaxseed can reduce inflammation, which leads to cancer. Garlic, I used to wonder, like, why is my grandmother cooking with the garlic and the ginger? Why don't we just throw Maggi in this stuff now? What's all this problem? And then I did not realize the wisdom that has come with age. Now, I never put Maggi in my food, but garlic, ginger, all those herbs, those natural spices, they have antioxidants in them. Garlic contains something called allicin, which has been shown to reduce the risk of cancer, certain types of cancer, such as stomach and colon cancer. And then green tea. Green tea is rich in polyphenols and antioxidants that have been associated with a lower risk of certain cancers and also inhibits tumor growth. So variety is the spice of life. Enjoy a balanced diet to help protect yourself from cancer. And when you're drinking these teas and doing, please limit your intake of sugar. There are other ways to, honey is natural, but everything in moderation, all right? Okay, we're almost done. So now let's explore some key natural remedies that have shown some promise, shown promise in preventing cancer. Please note that these are complementary approaches and should be discussed with your healthcare professionals in DABLE before you start making some changes. So one of them is curcumin. I talked about earlier, and that was how I got introduced to natural supplements. So curcumin is the active ingredient in turmeric. So the turmeric, that yellow spice you see on the slide, that turmeric that you can put in when you're blending your pepper, it's got some really good stuff in it, yeah? Curcumin is a powerful anti-inflammatory and antioxidant compound. What does that mean? It is a powerful product that can reduce inflammation in your body. People are like, what is inflammation? Inflammation is like when you're in pain, yeah? That part of the body that gets red, let's say, actually, a mosquito bites you, yeah? That redness, that's a sign of inflammation. There's some of the inflammation in your body, you can't see it, and curcumin helps take care of that. Studies have shown that curcumin can help prevent cancer, even possibly treat cancer. Also, another one is medicinal mushrooms. Medicinal mushrooms, they help boost immunity, and some of them can even inhibit cancer cell growth. A particular product called active exos-correlated compound is a group of chemicals taken from mushrooms and turned into a natural supplement. What it does is it helps boost immune function. And for example, some people that have cervical, say they've been found to have a virus that can cause cancer, it can actually help protect the person from getting cervical cancer. So you may have the virus, but this can help boost your immunity and help prevent the cancer. Other examples of mushrooms to include in your diets are like the Mont mushroom. So some people, the other name I could find for it was Oluawo, and then reishi mushroom, and then the king tuber oyster mushroom. And then there's some things that are out there that are a tad bit controversial, but it doesn't hurt to increase your intake of them, yeah? Selenium is one of that. And selenium has been linked to reducing some cancers, but it's kind of controversial. And foods that are rich in selenium will be like your fish, your organ meat, so like your kidneys, your liver, all of those good stuff. Organ meats is different from red meats. So those organ meats are really rich. You can eat more of those. Brazil nuts, chicken, and eggs. Another one is vitamin D. And this one is also it's a big one I like to talk about. Vitamin D regulates cell growth, and it boosts your immune system and can reduce cancer risk. Even though we have a lot of sun in Nigeria, right? Everywhere it's all sunny, our modern day lifestyle significantly limits the amount of direct sunlight that our skin gets. So our dark skin, our beautiful chocolate dark skin, it limits the amount of vitamin D that your skin can make from the sun. Also, if you're one of those people that dress like me, that you cover your whole body, well, a lot of sun is not getting on you, yeah? So the only way to know if you have low vitamin D is to get tested, and DABLE can help you with that, right? Good sources of vitamin D include wild mushrooms, the sun, and if needed, vitamin D supplements. And so please ask your provider for the right dose to take. So, we're gonna be ending very soon, but we recently heard of King Charles of England, who has been diagnosed with cancer. You may wonder, he's rich. How can he develop cancer? Well, we don't know his lifestyle, right? We don't know if he was under a lot of stress. We also heard that he'll be using herbs and potions to heal instead of chemotherapy. To each their own, but my heart goes out to him and his family, and I wish him a complete recovery. So taking from other people's stories, you can learn on how we learn from history. That's why we learn about history. Like, why do we take history class? So you learn from history. So history does not repeat itself. You hear this people's story. Don't just say, hey, yeah, sorry. No, think. Adiola, what can I do about my life? How can I make changes in my life? How can I reduce my stress? I want to be superwoman, but gosh, if I die tomorrow, somebody else will replace me. So what are you going to do about that? So that's what I would like you to think about. So cancer can get anyone, rich or poor. Just do your best by making informed choices in your daily life and leave the rest to God. So we've covered a lot of ground in a short time, from understanding understanding the risk factors for cancer and how we can use natural means to possibly prevent the risk of cancer. Thank you so much for having me here today. I really appreciate you, and I appreciate the audience for taking the time to be here with us. You'll have a good one, and I will take your questions after. Thank you. I'm going to stop sharing right now.
Thank you so much. Thank you so much, Dr. Adeola. That was an amazing session. I don't know about you, but I learned a lot, and I'm more motivated now than ever to make lifestyle changes. And I know you have lots of questions burning on your mind, but don't worry, we'll have a session for question and answers. So let's move on to our next speaker. Dr. Anoluwaposani is a highly skilled and compassionate medical doctor devoted to advancing cancer care. She has dedicated her career to the comprehensive treatment of cancer patients, specializing in the personalized and precise application of radiation therapy. Her expertise extends to collaborating with multidisciplinary teams to develop comprehensive cancer treatment plans, emphasizing patient-centric approaches, driven by an and enhance the quality of lives for those navigating the challenges of. So please welcome with me Dr. Anoluwaposani as she makes her presentation. I'll be sharing the screen on her behalf, so get ready to have an amazing time of even learning more about holistic prevention of cancer. Dr. Sani, you have the floor.
Thank you very much, everyone, for having me. Thank you very much, Dr. Adeola, for your very insightful presentation, which you went through. In which you went through a lot of the lifestyle factors on cancer, about cancer. And so today I'll be taking up from where you stopped. Dr. Sharon, please, can you help share the slides? Thank you very much. Just can you start the slide share? Please start the slide share. Thank you.
Can you see the screen, Ma?
Yes,
yes,
I can.
I have. Can you see the screen? Okay, all right.
Yes. Okay. Yeah, so next slide. Next slide. Next slide, please. Next slide, please. Okay, so The outline I'll be using, can we go to the next slide, please? Yes, so we can start the slide share from this slide. Thank you. So this is the outline I'll be going with. Just a brief explanation or definition of what cancer is, how common it is, how do we prevent cancers, and so just a brief through on the lifestyle factors and some cancer-specific recommendations. So next slide, please. All right. Should I go on, Dr. Sharon?
Yes, please, you can go on.
Okay. All right. So so cancer is abnormal cell growth invading tissues, usually potentially spreading to other organs. The reason why it's called cancer is because it starts from a particular tissue or organ or a group of cells, and it has the potential or the ability to leave its primary site and move to distant sites in the body. It can also, so when you hear about cancer, there are other names that people use to refer to cancers. Some people say malignancies and neoplasms. All of them are cancers. Sometimes you hear sarcomas, sometimes you hear carcinomas. All of them are words that are used to refer to cancers. So cancer ranks among the top causes of death worldwide. It poses a significant public health challenge in both the developing countries like Nigeria and also in industrialized nations. We see that the burden, when it comes to the body, has a high mortality burden in which mortalities from cancer and cancer-related issues, from cancer diagnosis and cancer-related issues ranks high. For example, in 2020, GloboCan recorded 124,815 people, because we say cases, but they're actually people, men and women, old and young, who were diagnosed in Nigeria. And it's been said that 16 million cases are reported worldwide annually. And out of this number, 70% comes from developing countries, which shows that we have a long way to go in the ways with which we prevent cancers and also in which we diagnose or screen for cancers. Our mortality rates are quite high, saying that we have out of 70.7 out of 100,000 population and 9.5 out of 100,000, showing that women are die more than men when it comes to cancers. So we see that the top 5 causes of cancers in women especially are breast, cervical, that's the neck of the womb, cervical cancers, non-Hodgkin lymphoma, colorectal cancers, and ovarian cancers. Next slide, please. Next slide, please. So how do we prevent cancer? Now we see that cancer is a preventable disease that requires lifestyle changes, which Dr. Adeola has gone into a lot of detail about. The World Cancer Research Fund, that's the WCRF, estimates that 80% of cancers that occur yearly are developed from lifestyle factors. And these lifestyle factors continue to influence the disease and the treatment outcomes even after cancer diagnosis. Now, WHO showed us that a third of cancer cases are preventable, while a third can be cured. Now, looking at all this data, which has been gathered over the years, decades and decades of research on cancers, that we see that lifestyle factors are things that we actually have to look into. And this is why this seminar on holistic prevention of cancers is of utmost importance to us. Next slide, please. Next slide, please. All right, so lifestyle factors which I'll go through. We have to stay tobacco free. Now we see that cigarette smoking is the leading cause. What do? We quit smoking. For us, or if you know anyone who's of importance to us, like our family members, our friends, our co-workers, our neighbors. We have to look at all this, we have to ensure that all this is being followed through. Now, what are these? We have to quit smoking, no chewing of tobacco. We have to avoid secondhand smoke, which is actually very important. It's the key cause of lung cancers. Now, lung cancers are not even, tobacco smoking is not as of importance as before when it comes to lung cancers. Research has seen that secondhand smoking is even of more importance in the development of lung cancers than even direct smokers. That's why we have to avoid secondhand smoking. Next slide, please. Then when it comes to the nutrition, a healthful diet helps to provide adequate nutrition to meet the recommended daily allowance that are consistent with national cancer prevention recommendations. And for example, endometrial cancers, right, has been linked to diets that have high glycemic load. The risk of colorectal cancers is also increased with the intake of processed foods, red meats, and intake of 2 or 3 alcoholic drinks per day, while a diet rich in whole grains, food containing dietary fiber, and calcium was seen to reduce colorectal cancer risk. Regarding alcohol, for alcohol, we have to limit alcohol. 0 is best. Now, that is the mantra. 0 is best. But if there's a situation in which the client or we cannot avoid drinking alcohol, then we ask for moderation, moderation being the key, and to try to choose non-alcoholic beverages at meals and at parties when compared to alcoholic beverages. Maintenance of a healthy body weight. Now, when we talk about a healthy body weight, it's because of the relationship of obesity to the development of cancers. Now, maintaining a healthy body weight can be achieved through an individualized combination of diet, exercise, and other interventions, because we see that what works for Mr. A doesn't have to work for Mr. B. What works for Mrs. C may not actually tally with Mrs. D's, body. Now, obesity has been defined as the excessive or abnormal accumulation of fat or adipose tissue in the body, and this has been seen to impair health. It has been linked to, it has a high association with a lot of disease conditions in the body, but our concern of today is cancer. Now, how do we check for this? We talk about the BMI, that's the body mass index, and sometimes we also use the waist to hip ratio in checking for obesity. Now, there's been sufficient evidence of obesity being linked to the development of esophageal adenocarcinoma, gastric cardiac cancer. Okay, so cancers of the esophagus. Of the stomach, cancers of the colon, cancer, pancreatic cancer, also breast cancer in postmenopausal women because of the aromatization of estrogen. Also, it has been linked to endometrial cancer, like I mentioned earlier, ovarian cancer, kidney cancer, meningioma, thyroid cancers, which are seen in the neck, usually as a swelling in the anterior part, the front of the neck, and also when it comes to multiple myeloma. Current evidence is consistent with the hypothesis that obesity has both a causal effect and a plausibly reversible effect on cancer risk. What this means is that data shows that obesity can cause cancer, and at the same time, as a high effect, as a high cancer risk, contributes highly to cancer risk. But when that individual works on his or her weight, and this obesity is reversed in that person, we see that the cancer risk drops significantly. Regarding active lifestyle, few things are as good for you as regular physical exercise. And it has been recommended that we should have at least 150 minutes of exercise in a week. So this goes to about 30 minutes of exercise daily for about 5 to 7 days in a week is good enough. Now we talk about moderate intensity exercise. What are those? That's brisk walking, cycling, brisk walking, cycling, gardening, basically the exercise in which you may be able to talk, but you cannot sing. This helps. Studies showed that these physical exercises can cause low rates of all causes of mortality, coronary heart disease, high blood pressure, stroke, metabolic syndrome, type 2 depression, type 2 diabetes, depression, and falling. Why? Because it helps with our cardiorespiratory and muscular fitness. Gives us healthier body mass and composition. Also helps to improve our bone health, also our cognitive health and our functional health. For cancer, another point which is of importance is the prevention and treating of carcinogenic infections. This means infections that have been linked to the cause of cancer. Now, HIV tops the list because we see there's a group of cancers which we call HIV-associated malignancies. HIV, human papilloma virus. For HIV, we have the anal cancer, cervical cancer, for human papilloma virus, and that is where cervical cancer also is of utmost importance. Cervical cancer 16 and 18, also 6 and 11. It's of importance to be screened and to be treated as soon as possible. For the HIV, we need to know our HIV status. We need to know our status. We need to practice safe sex. We need to avoid risky behaviors. In that, for your partner, you need to ensure that you have avoid having multiple sexual partners, and also avoid having a partner who has multiple sexual partners, so that this will reduce your cancer risk. So others are hepatitis B virus and the others that are listed on the screen. Abstinence also is recommended, and also vaccination. Now, vaccines have been produced against HPV for young, and it's been recommended to be given in young girls to prevent them from developing cervical cancer later in life. Next slide, please. So exposure to UV radiation. Actually, what we'll be talking about is exposure to not just UV radiation, which is ultraviolet radiation, but we're also talking about exposure to ionizing radiation. Ionizing radiation is actually the kind of radiation which is highly linked to cancer development. And those are the X-rays and the gamma rays. Now, we've seen that data has shown that up to more than 10%, up to 10% of cancers are radiation induced, especially leukemias, lymphomas, thyroid cancers, sarcomas, lung cancers, and even breast cancers. For example, maybe a child had radiation therapy to the chest earlier in life for either a non-cancer or cancer cause. It can lead to the development of cancer in that person later in life. Previous slide, please, because also UV radiation, we'll talk about UV radiation from the sun. Now, the previous speaker mentioned the importance of having sunlight, being exposed to sunlight and all. Yes, that is also is very important, but what we have to do, we have to limit our sun exposure before 10 a.m. We have to monitor and limit our occupational exposure because, for example, some of us who work where we are constantly exposed, not just to ionizing radiation, we are also exposed to the sun. So we have to insist on personal protective equipment. We have to insist on personal protective equipment. We have to try to also living near power lines have also been associated with increased cancer risk. Family history of malignancies. The reason why I put that picture is I'm sure almost everybody knows the person in the picture, Angelina Jolie, a very popular, a very famous actress. So because when I say family history of malignancies, because when there are mutations in the gene. For example, breast cancer, some subtypes of breast cancer have been strongly linked to BRCA1 and 2 gene mutations. These genes are seen within the DNA, and if there is any mutation in it, it increases it. So for her, because her first degree relative was diagnosed of breast cancer, and when she did her genetic screening, she saw that she also had that mutation. So she went for a prophylactic mastectomy, in which she removed both breasts. She removed both breasts, she removed her ovaries, her womb, to prevent the risk of having breast cancer. So what we're saying is when there's a family member who has breast cancer, it increases the risk of the person having breast cancer. So when you have a family member that has been diagnosed of any form of cancer, you should be on the lookout. You should start screening. You should be on the lookout. You should go to your doctor, go for all the necessary screenings and any necessary or suggested interventions as may be dictated by your doctor. Now, next slide, please. Next slide, please. So cancer-specific recommendations. Cervical cancer. For cervical cancer, vaccination is key for young girls. So, there are 2 vaccines that are available even at the Ministry of Health for vaccination against cervical cancer, usually before the person starts having sexual intercourse. These vaccines are given before the person is exposed to the human papillomavirus. So screenings are also important, like the need for a pap smear, in which your doctor will take a swab from your private parts, just a swab to check for if there are any cells, if there's anything that is suspicious, so that it can be acted upon before even the cancer, because there are precancerous lesions in cervical cancer that can be treated to prevent the development of the full-blown cervical cancer. For colon cancer, for people that have a positive family history of colon cancer, the need for regular screening, colonoscopy, sigmoidoscopy. The doctor may have to put a camera up to see if there are any suspicious looking lesions, suspicious looking things in the intestine, usually the lower intestine, and to get it out as soon as possible before it develops into cancer. Also, the occult fecal blood test. Usually the recommendation is that it can be started from the age of 50 years. But if there's a positive family history, maybe it's first-degree relative like a brother, someone in the nuclear family, or someone in the extended family, then the person has to start it earlier. Then regarding breast cancer, there may be need for a double mastectomy or a bilateral saphengoophorectomy in this case. For skin cancer, the individual will need to have excision of suspicious skin lesions for histology of these skin lesions. So in conclusion, the easiest way to reduce the scourge of cancer is prevention. Now, holistic measures, like we've seen, are the cheapest and the most effective ways of reducing our cancer risk. Holistic measures, like we've seen, all of these are the cheapest ways. It's better to reduce the risk than to actually treat these cancers. Now, this is our collective responsibility as individuals, as members of family, as members of community, and even in this nation. And thank you for this opportunity to get this word out. Thank you very much, Debo, Africa. Thank you, Dr. Sharon. And please, if you have any questions for me, you may have it, you may share it with the team so that I can answer once it is read out. Thank you.
All right. Thank you so much, Dr. Sani. I don't know how, it's been so amazing having both of you here. It's been so impactful. And straight from Dr. I've learned a lot. And Dr. Sani was talking about the research that has been done, letting us know that, okay, like both speakers have mentioned, it can happen to anybody. And while we don't pray for it to happen to anybody, we need to be proactive about our health. And if there's anything you should have taken from this, is that there are steps you can take to make sure that you're well armed against cancers. So thank you so much to Dr. Oke and to Dr. Sani. We really appreciate your expertise and for teaching us so much and giving us practical tips on how to ensure that well far spent, and so I'll just give a chance for a couple of questions. If you have any, please keep them in the chat box and we will get them to you. But while we wait for the questions to come in, both speakers did emphasize checkups and, making sure that you are checking yourself for things that could potentially lead to cancer. And that's why Depo Africa is here. We're here as an outlet to help you to have a place to come to. You have questions, or how do I know, what's has our website, www.depo.africa, and we'll there to answer your questions. And so I'm also running a very amazing promo. We're doing pap smears as a very discounted price. So this is also part of the need to prevent cancer in our society, and we are doing as much as possible to let women know there are things you can do to prevent and to have early detection of these things. So if you have any questions, please let us know. And if you have any comments, anything you want to maybe tell us after, you can leave us a text message, you can give us a phone call, or you can even email us, whatever is most comfortable for you. You can also go to our Instagram at Depo_Africa, our social media, Twitter, and every other platform you can think of. Okay, so I'm not seeing any questions yet in the comment section. I just want to give you, I just want to encourage you to just ensure that you take proactive measures, like our speakers have said. And I want to commend you for taking your time on a Saturday evening to join this webinar. That's the first step, really, and that's the best step you could have taken today. So thank you so much for joining in. I'm still waiting to see if there are any questions. If I've missed any, please point me towards the questions. If not, I'll just give you a couple more minutes and we'll call it a day. If you have any comments, if you have anything to say on this webinar, you can as well just feel free to let us know your thoughts, let us know how we can help and how we can build a better society. Like Dr. Sani said, it's our collective responsibility. So we need to ensure that we are helping one another and growing as much as we can. All right, so I'm not seeing any questions here. So again, it's about time that we call this a day. So in the absence of any questions, thank you so much, Dr. Oke. We really had an amazing session learning from you. The practical tips you gave us, talking about natural remedies and foods that could prevent cancer. I don't think anybody would forget that. And that is valuable information that we do not take for granted. Thank you, Dr. Sani, for taking us through the research, for giving us the medical basis and backgrounds for the things that we're talking about, helping us to understand why and how we can take proactive measures for our health. Thank you, everyone, for joining us. And this is Depo Africa. We really care about you, and your healthcare and your well-being is our concern. And again, you can easily reach out to us on any of our platforms. Thank you, everyone. Enjoy the rest of your day.
Thank you, Dr. Sharon. Thank you, Dr. Adeola and Dr. Anu. I really appreciate it. Have a lovely day.